Hello, and welcome to this introductory presentation about MO1021 Food and Health. This module builds rural generalist knowledge and skills in nutrition and dietetics in rural and remote communities. You will examine assessment, planning and implementation of interventions for individual consumers with complex health issues, articulating the challenges associated with rural and/or remote contexts. The intended learning outcome for this module is that you'll be able to assess, manage and monitor the dietary and nutritional needs of individual consumers in a rural or remote community to facilitate best practice patient-centred nutritional interventions. This module goes for 6 weeks with 22 hours expected workload. You can see the weekly topics here. Weeks 1 to 3 of this module are based upon an adult case scenario, while weeks 4 to 6 are based upon a child case scenario. In week 1, you will choose a consumer for assessment task 1 and gain their informed consent to partake before gaining a snapshot of overweight and obesity in the rural and/or remote context. You will then learn about popular self-management approaches, explore motivational interviewing and consider the impact of self-efficacy before taking a closer look at readiness to change. In week 2, you will familiarise yourself with the nutrition care process and model before exploring challenges associated with the rural and remote context. You will then familiarise yourself with the adult case scenario and gain an overview of the clinical practice guidelines for the management of overweight and obesity. Finally, you will begin to apply the first steps in the 5 A's approach to self-management: ask and assess and advise to the case scenario and your chosen consumer. In week 3, you'll continue to apply the 5 A's model approach, steps of assist and arrange to the case scenario and your chosen consumer, before discussing your chosen consumer and the case scenario with your supervisor and with your peers via online discussions. Finally, you'll submit the module workbook to gain feedback on how you are doing so far. In week 4, you will familiarise yourself with the child case scenario before researching your chosen consumer's health issue. You will then seek out and map services and consider service delivery strategies for both the case scenario and your chosen consumer. In week 5, you will consider assessments and interventions before assessing your chosen consumer. In week 6, you will further consider interventions before discussing your chosen consumer and child case scenario with your supervisor and with your peers via online discussions. Finally, you will draft, discuss and submit an intervention plan for your chosen consumer. A single assessment task is due at the end of the module in week 6. The task is an intervention plan. You will also have the opportunity to submit a formative piece of work at the end of week 3. This is your module workbook, which is not marked but will give you some feedback on how you are going. We've built in some opportunities for you to interact with the content, the module coordinator and other participants who are taking the module at the same time. There are learning activities which include contributing to online discussions. This will provide a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all details of the assessment task and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns and enjoy the module.